Hello, Michael. Thank you for being here today. So you're going to talk to us today about meditation and how it has helped you to work with CPTSD, which is complex post-traumatic stress syndrome, or childhood post-traumatic stress syndrome. So please let us know how meditation can help.
Okay, sure. Well, meditation is a wonderful tool that supports us in our healing from our traumas. There are many different modalities that you can use, but meditation is a great one because you can bring it anywhere at any time. Through meditation, you can develop a sense of autonomy. You can think of meditation as a safe container for which to meet and understand your experience. And from there, you can learn how to skillfully meet the needs of the moment. So you can learn how to embody your triggers, how to meet them in the sense in the body, and then from there you can, by developing that sense of intuitive trust in your internal wisdom, you can move from there into a stronger sense of who you are. Yeah. So in my own journey, I found many different types of meditation very supportive. Meditation strengthens a lot of different skills that we have, and so one way we can use meditation is by learning how to regulate in the moment, how we can find a sense of ground, a sense of peace beyond the experience that we're finding difficult in the moment. Other ways we can use meditation are learning how to love our experience, how we can heal our relationship with ourselves, how we can turn towards ourselves with loving kindness instead of shame, criticism, self-reproach. Another way that meditation is very helpful is that we can tap into the power of imagination by working with our triggers and using different types of meditation techniques to support the experiences that come up and heal them completely so that they no longer trigger us any longer. Meditation is really great at helping us develop what's called equanimity in Buddhist tradition.
Equanimity?
Equanimity, yeah. It means basically acceptance of the present moment without any kind of push or pull away. We're not fighting reality. The more equanimous we are with reality, the more acceptant we are with what's going on in the present moment. And so that is a very helpful practice at helping us widen our window of tolerance, so that way we're not triggered into dissociation or shut down or freeze. We can increase our capacity to take more and more of our experience in and digest it, allow it to flow through and complete itself so that it no longer stays in the body.
So when you work like one-on-one, you work with group, you have you identify first the trigger with the people, or they do that process on their own?
Yeah, so the course that I wrote to teach during the pandemic that I never actually taught, it starts by first introducing how meditation can be used to ground ourselves, how to come back into regulation, how we can use it to deal with things that are difficult in the moment. So we build that base skill. And then from there, we begin to take our experience towards things that are a little bit more difficult. So most people with CPTSD have very negative views of themselves. And so there's different Buddhist meditation techniques that help us change that view, that help us repair the relationship that we have to the view of self, so that we begin to love ourselves, or we begin to direct love and compassion towards the suffering that we're feeling when we're triggered, instead of the shame spirals, the depression spirals, the anxiety spirals that usually come up when we're triggered. So when one notice that I'm been triggered by something and I feel really small and young, instead of saying internally, I shouldn't feel this way, I shouldn't be reacting this way, I should just run away, we can teach ourselves to automatically or skillfully bring the view back to ourselves that our pain is valid, our pain is worth loving, and that we can then hold that with love, which allows the experience to then pass through. And then the next week was about learning how to sit with any kind of uncomfortable situation, a type of meditation practice that increases our equanimity, our ability to hold experience without needing to turn away from it or hold on to it, that allows it to flow through. And then the last week of the course was a way that we can use visualization, imagination to completely change our relationship to our difficult experiences. We sort of use things that are based off of Tibetan deity practice, where we imagine all like a specific deity that is the embodiment of compassion or the embodiment of love, and we take them inside to ourselves. We do something similar to that where we, there's a bunch of different ways, but one of them is we imagine ideal parents or perfect nurturers who can meet us anytime we're feeling difficulty. So we don't necessarily have to love ourselves. We can sort of love ourselves the back way through these imagined ideal parents.
Wow, that's quite interesting.
Yeah. Oh, it's the one that did the most in healing the childhood component of my CPTSD, the attachment stuff. So meditation can also be done with other people in ways that really supports our healing. It can teach us how to attune to someone else, how to be able to hold someone else's emotions without taking them in. All these different skills that through CPTSD we sort of lose access to or we never developed properly. So when I'm working with people, I sort of look at 3 pillars of experience. There's our early childhood experiences that we want to remap, we want to rewire, and then there's skills that we want to develop, we call metacognitive skills, thinking about our thinking about our experience in ways that can actually support our regulation of the experience as opposed to making it worse. A lot of times when we have a trigger, we go into shame or some kind of experience that then makes the emotion much bigger, much more difficult to hold, and then also a lot of times there's overflow onto other people. And then the last sort of area is teaching around how to collaboratively engage in relationships with other people, how we can help respect our own autonomy, how we can respect someone else's autonomy, but how we can still connect to someone without losing who we are or without holding our hands or our metaphorical walls to keep people away, how we can engage in intimacy that's both safe and respectful but is also deeply nourishing. So one of the most important things with trauma is that it lives in the body and that meditation is an inherently embodied process. It's something that we drop into our own experience to explore ourselves, and that naturally gives us over time a greater sensitivity to our embodied expression, into our emotional life, into our energetic life. And so when we can have that higher sense of sensitivity and attunement, along with the equanimity that is developed through time as well, we begin to learn exactly how to read our bodies, how we learn how to clear away the things that through trauma disconnect us from our bodies. So a lot of the things are oftentimes like I grew up where food was insecure, and so my natural response was to shut away any signs of hunger. And so gradually through meditation, those began to speak louder. They began to become clear to me, and I began to see the ways that oftentimes my behavior was because I hadn't eaten in a long time, and I was really hungry, and that was triggering. And so it can help us listen to our bodies better, and it can also help us begin to experience our bodies in a way that allows the trauma to pass through the body, that we begin to understand the innate way that the body's holding the trauma. There's some research that sometimes it's in the fascia, like in the muscle structures.
Yes, I heard that.
And so that we can, their meditation practice is built around allowing that emotion to like release through the body, so that we don't even have to go into the narrative, into any of the story. So there's millions of or dozens of different meditation techniques that allow us to build a more skillful and intimate relationship with our body in a way that allows us to do it gradually, so that we're not forcing ourselves to overexpose ourselves. We're not forcing ourselves to continually face triggers. there's a lot of ways of working with trauma through meditation that don't necessarily directly touch at it, which can make it a lot safer and easier to get at as well.